there was a report from McKinsey, I think a month ago, and they said that the only industry that is still full-fledged innovating is in health, in pharmaceuticals. And all the other industries are like decreasing the innovation and going back to their core services and core products. Yeah, so it's a good time for health, I guess.
Yeah, it's interesting. Yeah, it's an interesting discussion. I'm not sure if healthcare is still the only industry that's innovating. I think also a lot of interesting stuff happens in fintech, for instance.
No, I mean right now in the COVID crisis. The COVID crisis
for sure
changed the powers of
it
the
changed.
market.
It changed a lot in healthcare. Yeah, for sure. What we've seen here in the Netherlands, and from my experience of working in hospitals for 10 to 12 years, is that all of a sudden stuff was possible, and specifically using new types of technology, not really new, but new for healthcare or healthcare industry. It became possible to work more on a remote area or work with more remote solutions. For instance, the technology of video conferencing had been there for decades, of course, and was actually one of my first projects when I started in hospital was working on a specific video conferencing solution, but it was still too much the system that a patient would make an appointment and he would go to the doctor and drive to the hospital and park his car and get all stressed finding a parking space and then run up to the doctor's office and talk to the doctor on what was happening. And now all of a sudden we were doing video chats with doctors, and we were so the crisis made stuff possible that for some reason was not possible earlier on. So that was interesting to see.
There is a big gap that could have been like filled like years ago, and only now it happens. And sometimes people need a like crisis or a big change to do things that they were not willing to do before that, I guess. So
under pressure, everything becomes